1. Recommended temperature, time pressure for autoclaving, steam under pressure. Correct option is A120C 250F. At 106 kilopascals, 15 IBS/in2, for 30 minutes. 2. If nurse is administering a cleansing enema to a client with a fecal impaction. Before administering the enema, the nurse places the client in which position? Correct option is left Sims positions. 3. Who will be third-line manager for you at PHC? Correct option is C. Medical officer. 4. A nurse is preparing to insert a nasogastric tube in an adult client. To determine the measurements of the length of the tube to be inserted, the nurse should. Correct option is C. Place the tube at the tip of the nose and measures by extending the tube to the earlobe and then down to the xiphoid process. 5. Physician prescribed a hypotonic solution for a client. Which of the following 4 solutions would the nurse accept to prescribe? Correct option is B. 0.45% sodium chloride. 6. The nurse has obtained a unit of blood from the blood bank and has checked the blood bag properly with another nurse. Just before beginning the transfusion, the nurse asks which of the following items. Correct option is vital sign. 7. Best type of solution to use for the irrigation of urinary catheter. Correct option is B. Normal saline. 8. The most important way to prevent the spread of infection is. Correct option is B. Hand washing. 9. Which instrument is used to test the client's hearing? Correct option is B. Tuning fork. 10. When is International Nurses Day celebrated? Correct option is May 12. 11. A nurse is preparing a preoperative client for transfer to the operating room. The nurse should take which action in the care of this client at this time? Correct option is ensure that the client has voided. 12. The nurse is performing an abdominal assessment. The nurse performs which assessment at first? Correct option is B. Inspection. 13. While giving an intradermal injection, the needle should be held at. Correct option is 1.5. 14. Appropriate temperature of solution prepared for sitz bath should be. Correct option is A. 105-110 F. 15. The nurse determines that a client is having a transfusion reaction. After the nurse stops the transfusion, which action should immediately be taken next? Correct option is B. Run normal saline at a keeps vein often rate. 16. When suctioning an unconscious client, which nursing intervention should the nurse prioritize in maintaining cerebral perfusion? Correct option is D. Hyperoxygenate before. 17. Savlin is. Correct option is D, A and B. 18. Scald is a burn caused by. Correct option is moist heat. 19. When you perform CPR on an unresponsive adult, you should correctly assess the pulse of which location? Correct option is B. Over the carotid artery. 20. Which of the following would the nurse use as the most reliable indicator of a patient's fluid balance status? Correct option is D. Daily weight. Thanks for watching. Now subscribe MCQs Hub.